Hey everybody, welcome. I'm Dr. Izabella Wentz, PharmD, and today I've got a very special guest with me, Dr. Gio Espinosa. He's a renowned naturopathic doctor recognized as an authority in integrative and functional urology. Dr. Gio has published in numerous peer-reviewed scientific journals related to integrative management of prostate conditions and urological disorders. Dr. Gio has been a medical contributor to Men's Journal magazine, WebMD, and major medical textbooks. He is the founder and director of the Integrative and Functional Urology Center at the New York University Langone Medical Center, and lectures internationally on the application of integrative medicine in clinical settings. Dr. Gio has been recognized as one of the top 10 health makers for men's health by sharecare.com, created by Dr. Oz and WebMD. He's the author of Thrive, Don't Survive, Dr. Gio's Guide to Living Your Best Life Before and After Prostate Cancer, that will become available in November of 2015. On his time off from work, he enjoys writing on his popular blog, drgio.com, and participating in outdoor activities with his wife and 3 kids. So welcome, Dr. Gio. I'm so glad to have you here with us.
Isabella, thank you so much. It's a thrill, really. And you said I'm a special guest. I just get the idea, I get the feeling you say that about every guest that you interview. It's not just me.
No, that's not true. I don't say that about anybody else.
Okay, good. So then I feel good about that then.
One of the things, and I think one of the big things with thyroid conditions and Hashimoto's is that they primarily affect women.
Correct.
But thyroid conditions also affect men. And so I wanted to bring you on here because you are a men's health specialist.
Correct.
To really, really address this issue. And thyroid conditions may present a little bit differently in men. Can you talk about thyroid conditions, the rates, and how they may present in men?
What's interesting is that no one is looking at thyroid on men, right? And it boggles my mind that that is the case, right? Because oftentimes men present with clinical signs of hypothyroidism, but the first place where most people would look at, most physicians, is testosterone, right? And the testosterone is fine, and it's like, okay, what do we do? It's so erroneous not to look at at thyroid function in men that it's incredibly irritating, actually, quite frankly. So it is something that exists. It is something that needs to it needs to be part of any hormone panel, like testosterone and free testosterone. And actually, there is some sort of overlap with thyroid hormones and even testosterone and sex hormone binding globulins, right? So this needs to be addressed, and I'm hoping to develop some sort of a voice where more and more practitioners will just to get a particularly I take a thyroid panel on my patients every 6 to 12 months, right? Because I want to see if there's any changes that occur within that time, or if any changes that we need to address. But even if we do it once a year on men, that would be significant. So it's not only when they present with negative, with thyroid hypothyroid type of signs and symptoms, but also as a wellness type of panel, I think.
Mm-hmm. With speaking with some of my male and female friends and clients, a lot of women will complain about hair loss and weight gain. And those are some of the really big things that get to them. And then fatigue, of course, is another big issue that women struggle with. And then for men, one of the things that I thought was a little bit different and more unique is that men wouldn't necessarily pick up on the hair loss per se.
I sure wouldn't.
Yeah, wouldn't necessarily pick up on the weight gain. But the things that they've said is definitely, fatigue. But they're also talk about how they're not growing beard hair. So I know it's November and you've got Movember.
Can you see that?
Yeah.
I'm all in with the Movember movement. Absolutely.
And so that's been one of the things that men will say when they have, Hashimoto's or thyroid issue. They'll be struggling with not being able to grow facial hair, which of course women would not typically complain about. And they also talk about issues with libido. And we do know that basically whenever you are hypothyroid, that's going to pretty much crush your libido in a lot of cases.
Absolutely. Even hyperthyroid and hypothyroid all affect, libido and sexual function in men. The other things that you would notice in men is a decrease in muscle mass. okay, which is oftentimes attributed once again to just testosterone, but the thyroid hormones play a role there as well. So weight gain is not it's not something that's picked up by many clinicians just because it's sort of like if a man has a pot belly, sort of expected, right? Of course you would have a pot belly, right? Right, right. And it's kind of so not as much as with women. So weight gain is not one thing that most clinicians would pick up on. They just see it as aging or low testosterone. Decrease in muscle mass is also attributed, of course, to testosterone, but also to thyroid hormone. Erectile dysfunction, actually, so the inability of maintaining an erection satisfactory for intercourse is another sign of hypothyroidism. Sperm count or a decrease in sperm count or sperm motility can be caused by hypothyroidism as well. So, and of course, fatigue and all these other things. Once again, that most clinicians just look at testosterone. Thyroid function needs to be a part of that conversation or a part of that visit workup.
Mm-hmm. Thank you so much. That's very, very helpful. I, one of the things that I recommend for people with Hashimoto's is selenium. And it's been found to reduce the rate of thyroid antibodies by about half over the course of 3 months. What a lot of my clients have seen is it helps to reduce their antibodies. It helps to reduce anxiety. It helps to reduce fatigue. We'll see less hair shedding with getting more selenium on board. And so this has been something that's been very helpful, but every now and then I'll get a question from a male reader that will ask about the connection between the prostate and selenium. And I know you are the expert here, so I would love to have your feedback and your perspective on this, because we know that women don't have a prostate. I think most of us know this, right? So for women, taking a selenium supplement is not going to, it's pretty much mostly been implicated to have, for women who we know do not have a prostate, taking a selenium supplement, there's not a lot of downside, but there can be some concerns for men.
Yeah. So selenium. So I guess the reason why you're saying that is because since I have so much time in my hands, and I just decided to write a little selenium book. So I'm in the process of doing that, and another book that's coming out in a couple of weeks, as you mentioned, on prostate cancer. So selenium is a major trace element that I just think is overlooked by many clinicians and lay people overall. There are many people that have low selenium levels. And what the studies show pretty clearly is that those with low selenium levels have much higher risk of different cancers or of developing different cancers, things like colon cancer, lung cancer, and prostate cancer. So now we have this this trace element that not only plays a major role in the conversion from T4 to T3 systemically, but now it has also other protective elements, including in male infertility, and including in cardiovascular health, and including in protection against cancer. So it just boggles my mind, quite frankly, that when my patients come in with their 35 different supplements that they're taking, oftentimes selenium is not one of them. So it's not only about selenium. I think it's very important to ascertain the type of selenium, the form of selenium. So there's different kinds out there. There's the inorganic selenite and selenate, and there's the organic version, selenomethionine, and other versions that are from yeast form, like high selenized yeast, which has a combination of selenocysteine, methylselenocysteine, and selenomethionine. I mentioned that not to overcomplicate things, but because actually form seems to matter. The form that I like, whenever possible, I like to, and if I'm going to prescribe a supplement, I like to prescribe something that is as close to food as possible, right? Because food has all the different elements that are important to work synergistically and to have an effect. The problem sometimes with food, because some people say, well, can I just eat 5 Brazil nuts or 10 Brazil nuts a day? Yeah, you're not doing that. All right, you're not going to do that. No, I don't know anybody, right? Even the most foodie person I know is not going to consume 5 Brazil nuts every day, right? And the
Well,
reason
plus you don't know the content of selenium in the Brazil nuts, so you can be underdosing or overdosing yourself depending on where the Brazil nuts were grown, right?
you can have 0 selenium in some Brazil nuts depending on where it's grown, and then the other. So what are the other foods? Wheat is high in selenium, but you and I both know that a lot of people are wheat intolerant and gluten intolerant, so that's not good.
Especially with thyroid issues.
Particularly with thyroid issues. Fish. Well, what study shows that, while some fish can be high in selenium, the absorbability of the selenium from fish is not that great. So we do have to depend sometimes on dietary supplements. So my favorite is high selenized yeast. Why? Because number one, that's the type that's shown to have great anti-cancer protective abilities. A study that came out in 1996, published in JAMA, showed that high salinized yeast significantly reduce the formation and development of different cancers: colon cancer, lung cancer, prostate cancer, and one other cancer, I believe is breast cancer, perhaps, but don't quote me on that one. The bottom line is that there's protective benefits there. So when I provide supplements, dietary supplements to patients, I'm trying to get the most bang for my buck, or the most bang for their buck, right? What kind of dietary supplement can address as many things as possible? And so I think high selenized yeast selenium is the way to go, and I've done some extensive research. So then, of course, there's beneficial thyroid benefit there in terms of a conversion. There are many things that selenium does. It has its own antioxidant activity, and it also works synergistically with vitamin E. Particularly mixed tocopherols and not just alpha tocopherol. It's involved in the production of glutathione, very important, a master powerful antioxidant. So selenium it's incredibly essential. I don't prescribe any other type, like selenomethionine, which is the type that was actually that's most commonly used. Selenomethionine has shown in the SELECT trials. A SELECT trial was this humongous prostate cancer prostate cancer prevention trial, showing that so the amount of subjects that were recruited were 35,000. This study was about $150 million to $200 million study, which it looked at a few arms. It looked at alpha tocopherol vitamin E by itself or placebo, or selenium in the form of selenomethionine or placebo, or the combination in placebo, and to see if they had any effect in the prevention of prostate cancer. Bottom line is the study was stopped short, saying, well, these two elements did not prevent prostate cancer. Later on, more research showed that selenium actually increased the risk of prostate cancer in the form of selenomethionine specifically. Well, that's not the form that was used in the 1996 study. The form that was used there was high selenized yeast. And I think that plays a major role here. So bottom line, selenium, very important, obviously, for thyroid function. The right type in the right form is also very important for reducing the risk of multiple cancers.
Yeah, I definitely think looking at the formulation is going to matter. And with thyroid studies, all of the basically studies have shown that it's actually selenium methionine that's the beneficial one. But then we've got a study with prostate that's showing that this is potentially can exacerbate certain types of cancers. Now, or especially prostate cancer, do you think that it's basically the lack of being in balance with the other types of selenium that are found in the yeast that has an effect, or what's your kind of theory behind this?
I think so. I think once again, the closer, for example, I'm not a big fan in most cases of prescribing just vitamin C, ascorbic acid, right? In most cases, there's potential therapeutic effects, but once you super concentrate any element from nature, it has the potentiality of having more side effects, like anything else, right? So I think there's synergistic benefit with the yeast. I just want to be clear that in the selenized yeast, there is about 60 to 70% selenomethionine.
Mm-hmm.
in the yeast. So that's the majority of what's in it, right? So yeah, selenized yeast may have clearly an effect, because you're right, with regards to thyroid studies, they've used effectively selenium methionine. Well, that's in within this complex and this organic complex of the yeast.
Now, if somebody had a yeast sensitivity, so we know that a lot of people with Hashimoto's, when I do food sensitivity panels for them, it's yeast is one of the biggest things that comes up positive, and then we have issues with candida overgrowth and things like that. So would this be potentially contraindication with somebody with a yeast sensitivity, or is it going to be different?
Absolutely not. There's absolutely, and not only have I looked at any research, but in my clinical practice with those with yeast that have high candida levels, there's absolutely, it's almost, it's the analogy is, not consuming food with cholesterol because it would raise your cholesterol.
Mm-hmm.
Right? We know that that's not the case, right? You can consume foods with cholesterol. You can consume a dozen of eggs every day. That will not necessarily raise your cholesterol levels. This is exactly the same situation where the yeast is actually dead yeast. It's just used because when you in that yeast process, it makes its own, enough of these compounds and particularly selenium in the right kind of situation. So no, there is absolutely no connection between the use of high salinized yeast, selenium, and candida or yeast overgrowth.
Thank you for clarifying that, because
Yeah,
I know
good question.
a big question from people, because whenever we talk about, like doing Saccharomyces boulardii or another beneficial yeast, I always get that question about,
Excellent question. Yeah.
is that going to be a concern?
Yep.
And then, women's perspective on prostate cancer, because a lot of times, you are a men's specialist, but a lot of times women will come seek you out.
Yeah. So, So here's the deal. I tell you, so I'm super passionate and excited about the fact that I've chosen a long time ago to specialize in men's health, right? Because it's not too many practitioners are doing it, and quite frankly, men need the most help. I mean, we're really screwed up, right? We're stubborn. We have to be sort of half dead before we pay attention. So if we have that, I always say to men, listen, if you have that that something changes, let's say you start developing headaches and you're not a headache person, then you need to pay attention. Well, what men do is fight through, right? We fight through everything. And while I understand that mentality, because it takes, I'm a man, there's some limitations to that approach, right? You need to pay attention because maybe that's a sign of something else, some cardiovascular disease, tumors, or something else. So one of the things that I've started doing, because just the nature of my practice, right? So, 60%, 65% of the times, who's bringing their male partners into my office is the women, right? Whether it's a spouse, a girlfriend, a mother, or a daughter, right? They're dragging their men into my office. So clearly women play a big role in male health here, right? And quite frankly, women just ask better questions. Right? Kind of, men don't want to know too much, typically. They don't want to face their mortality or their vulnerabilities. And women just ask the right questions. They do better research. So I almost tell all my male patients, don't come in here without your spouse if you have one, or without a female, right? So what I've attempted to do with a book that's coming out on prostate cancer is include sections on notes to your partner, right? So that women can have a better understanding of, look, what your partner is going throughout the diagnosis and everything. So I guess there's some key elements that would be useful to your audience in case, look, you never know who, every woman will know someone eventually who has prostate cancer. I mean, it's just a matter of time. There are a lot of things that occur there. It's more or less analogous when a woman gets breast cancer and then sometimes they get a mastectomy, where they feel a little bit less feminine, right? For a man, it's different because it's not something that you can see, right? You can't see the prostate; it's within the body, and but still, they have all kinds of sexual issues as a result. So men typically, at least initially, would feel less manly as a result of that. So they may be more belligerent and try to act out as a result of the fact that they're not liking how they feel. You know, so I try to provide a certain protocol, a natural lifestyle intervention protocol that I call the capless method. And this is just a lifestyle protocol that I've studied over over a decade as to what works for prostate cancer. And I typically have their female partners do the program, right, with them to support them. At the same time, you want to be very careful not to be overly aggressive if he picks up a cookie to eat, right? Not to slap his hand, because men always want to feel like they're in control, right? So I think my wife, for example, with me does an excellent job making me feel like I'm making decisions and I'm in control, when indeed is not the case. She's in control and she's making all major decisions, but she's making me feel like I am. Right. And that's great because I know that what the truth is, and I'm fine with that being the case. But at the same time, I don't want to look like a wimp. Right. So I think that level of psychology of, look, let him make decisions, but guide him and do the program with him is incredibly beneficial. And, typically things that are good for prostate cancer are also good for breast cancer and breast cancer prevention. So, you kind of get a double benefit there.
That's really great. And how would one of the things that happen as men get older, you start seeing higher rates of enlarged prostates.
Yeah.
Is that one of the first signs that a man might have that something is off, or is that something that's going to be separate that needs to have a different type of protocol?
So if your man gets up 5 times a night, and that's clearly something that's going on. Now, it's oftentimes related to prostate enlargement, particularly if they're older, over the age, let's say, of 60. Mm-hmm. And they may have an enlarged prostate that's kind of squeezing in on the urethra, which is the tube that brings out the urine, which is, not allowing them to empty completely. Mm-hmm. That does not necessarily mean that they have prostate cancer. So an enlarged prostate is independent of prostate cancer. Okay. What may mean, and they need to be evaluated if they have prostate cancer, is blood in the urine. Okay. Right. So now blood in the urine can mean many things. It can mean bladder cancer. It can mean prostate cancer, or it can mean nothing major, nothing that, needs to be addressed. But if there's blood in the urine that is, obvious to any person looking at the urine, then, it should be evaluated. What's interesting, Izabella, what's interesting is that, believe it or not, one of the things that actually does help, and actually has been verified in the literature, in the scientific literature, with BPH, which is an enlarged prostate, is actually iodine. Mm-hmm. So as we're talking about thyroid function, right, iodine is a very important element and nutrient for thyroid function. But there's research suggesting that iodine actually also has prostate enlargement, or BPH, benefit, and also potentially protective against prostate cancer.
It's just interesting how the balance of different nutrients comes together, right?
It is unbelievable, actually. It's mind-blowing because, I take pride, maybe like you, I want to look at the whole system. So I never, I've always say that, I never have a walking prostate coming into my office, right? That's never happened. It's typically a man, because still mostly men, have prostates, as you mentioned earlier. I had a student at NYU, undergraduate, it wasn't NYU, some other school where I taught. And, long story short, the student did not know that only men had prostate. So I never take that information for granted, or just think that everybody knows that.
I had a classmate in anatomy class that was very surprised to learn that too.
Right. So yeah, you have to make it clear just so that, we're on the same page. So I never have a walking prostate, right? I have a man with a prostate. So to me, the challenge is, how are things interconnected here, right? How does everything work together? All the hormones, all the cardiovascular system, immune system. What's happening here, and what do we need to address? From a holistic perspective. So I got to tell you, thyroid and prostate connection, thyroid, and testosterone connection, and cortisol. It's incredibly interesting and is all interconnected. And to not address all these things or look at all these things, I think that we're doing a very poor job if that's not done.
Mm-hmm. Yeah, it's really, it's really important to kind of keep the things in perspective and keep things in balance with iodine. In some cases in Hashimoto's, when you go too high of a dose, that can exacerbate it. And then when you have iodine deficiency, that's also not good, because then you end up with hypothyroidism that's due to iodine deficiency.
And it's probably the same thing with selenium, by the way.
Right.
So it's probably the same thing. So, there is some data it's suggesting that if selenium levels are way too high, that it can actually promote some cancers, right? Right. So you definitely want to be careful. And I think that, I really, I discourage people from just going on the internet, finding information, going to Dr. Google and going by themselves, buying vitamins and doing things on their own. I highly discourage that. I remember when I tried to do my own taxes once, I actually got audited. Why? Because I did a poor job, right? So you definitely need experts. And so what I would encourage people to do is, look, find an expert, functional medicine or naturopathic doctors, or people like you that do, your due diligence and really do a great job in doing your research and figuring things out for people.
Yeah, it can definitely shorten the learning curve, because I've seen people just getting in trouble with doing really high doses of iodine on their own, or just doing different things where they had adverse reactions to the supplements, because, it's a lot of supplements, a lot of nutrients are Goldilocks nutrients and supplements. So they have a narrow therapeutic index where, a little bit of it is great. And then when you have too much of it, that's actually detrimental to your health. And it's not always something that you're going to be familiar with. And you may not be familiar with the signs of your own body that you're adversely reacting to something. So
Excellent. Absolutely.
Sure.
Yeah, no, thank you for that. I mean, that's, that's kind of one of my big, the big things that I talk about all the time is that, please, try not to do this by yourself. And then the other thing is that, oftentimes they're underdosing also on things, right? So they're not, they're not adequately dosing themselves, whether it's a botanical or a nutrient. So they're not really getting a good response, and they're spending a lot of money. So, yeah.
And then, and even if you are qualified or whatnot, like, surgeons never do surgery on themselves. Like, it's really hard to be objective with yourself. So, you can be the smartest, most knowledgeable person with 17 PhDs, but it's always good to work with another practitioner or another person that can actually look at you objectively.
Absolutely. Couldn't agree with you more.
And so, since we have you here and you are the king of urology.
The king. Thank you. The king of urology. I would say king is a strong word. I would say just, look, the fact of the matter is that the unfortunate thing is that there are not that many urologists or even naturopathic doctors that specialize in urology. But I think that's changing slowly, where it is becoming a specialization in terms of functional urology and naturopathic urology. So I appreciate that compliment, and I'm ready for your question.
So with interstitial cystitis, this is something that's going to be more common in women with Hashimoto's and men with Hashimoto's. And it's going to be something that, that is very distressful for people. It sounds fancy, but it can be quite common. Can you talk about the symptoms of that condition, and then what people can do to overcome it? Or what would your suggestions be?
All right, so let's not be so gender specific with interstitial cystitis, because actually the few times that I do see women is actually women with interstitial cystitis, right? So, let's see. So because with men is oftentimes confused with prostatitis, right? Symptoms can be very similar, right? And but typically you do a physical exam, you check the prostate, and there's no inflammation there, and there's no pain in the prostate. So that can be, interstitial cystitis, a little bit of a diagnosis of exclusion there. And with women, the symptoms are very clear. So the symptoms for both genders are, lower lower abdominal pain right above or right around the pubic bone. And it's, it's a pain that kind of doesn't go away. It's a dull pain for some people. It's a little bit sharper for others, but there's always pain there. It's exacerbated sometimes with sexual intercourse. Sometimes it's exacerbated with urine or with urination. And the other part of the picture is that there's urinary symptoms as well, whether it's urinary urgency or frequency or both. So that combination of lower abdominal pain right above the pubic bone and urinary frequency or urinary symptoms is typically a sign of interstitial cystitis. Interstitial cystitis is a diagnosis of exclusion. So just like irritable bowel syndrome, right? The interesting thing is that about 90% of my patients, or even in the literature actually, of those who have interstitial or have been diagnosed with interstitial cystitis also have IBS, also suffer from constipation. So once again, looking at things holistically, the GI system, the gastrointestinal system, the intestines actually are tightly connected neurologically to the bladder. And there are cells that are like pacemakers called the cells of Cagal, C-A-G-A-L, that are found in the bladder that are exactly similar to cells that are found in the intestines. Okay?
Wow.
So where do we go from here? What's the takeaway? The takeaway is the following: that anybody who treats interstitial cystitis by only looking at the bladder is not doing a good job. Okay, while there you can alleviate symptoms, because the symptoms can oftentimes be excruciating and quite frankly debilitating, the long-term benefit of treating interstitial cystitis effectively is by treating the gut. I'll say it one more time. You have to treat the gut. I'm serious, because what happens is, right, they look at these IC foods, right? The interstitial cystitis, the foods that you should not eat because they may exacerbate, things like tomato, acidic foods, wine, and so on and so forth. No one is looking at things like gluten and other food intolerances, which makes it worse. Okay? So, and you have to have frequent, normal bowel movements. So constipation is very tightly connected to IC. Takeaway. It's, let's see, what's a good takeaway here? So, the way if any listeners are suffering from interstitial cystitis, here's what you need to do. You need to definitely treat the gut. There's many ways of doing that. I'm not trying to play doctor over a podcast because I don't know the individual situation. But generally speaking, a good probiotic taken 3 times a day is a great start. Okay, 3 times a day. About 15 billion SFUs per dose. So with breakfast, lunch, and dinner. Okay, that's a good start. The other things that are actually excellent for interstitial cystitis is things like chondroitin sulfate, which actually people use for joint health, right, with glucosamine, right? But actually it helps because part of the issue with interstitial cystitis is that there's a leaky bladder. Mm-hmm. Just like there's a leaky gut problem, there's a leaky bladder. So there's an inner lining of the bladder that oftentimes is leaky. So it allows these solvents to go into the bladder, causing inflammation. So chondroitin sulfate can actually help with that in terms of building the integrity of the inner lining of the bladder.
Fabulous.
Okay? Yep. Natural anti-inflammatories, things like ginger, turmeric or curcumin, and quercetin. The first one that I would go for is quercetin. The reason why I'm hesitant sometimes with some patients is because sometimes maybe ginger or curcumin is too strong for their system and they don't respond well. Other times they do. When they do great. But I would start with quercetin because actually there's more literature with quercetin and things like bladder pain. Melatonin helps a lot with actually interstitial cystitis. So melatonin is a sleep hormone. Mm-hmm. There's no mistake that oftentimes patients with interstitial cystitis also have sleep problems, right? So melatonin specifically and especially in that patient, in that person who's also having sleep problems, can be really helpful. About 3 milligrams a night.
Mm-hmm.
And so between that, probiotics, staying away from food intolerances like perhaps gluten and dairy, and these other supplements, chondroitin sulfate, quercetin, and so forth, and probiotics can be very helpful. And of course, this particular approach doesn't work with anybody. There's different things to do. Acupuncture is great for pain management, for example. So seek a good acupuncturist. There's a lot of things to do. Bottom line, be patient with the process. Most people that I see get better, but they need to be patient. Sometimes patience can be an issue there as well.
Mm-hmm.
Hope that was helpful.
Yeah, that's very, very helpful. Thank you so much for sharing that. One thing I want to always remind people is if they're starting probiotics, always start low and go slow. So we may talk about some of the doses that are therapeutic, but if you have never taken probiotics before, you may want to try to introduce one at a time and see how you tolerate it before you go up in your dosages. And, I'm really excited to hear about melatonin. I've just heard, there's just so many different types of helpful implications for this hormone. One of the important things that we need for just being healthy in general, whether it's autoimmunity or thyroid or cancer prevention, is getting enough sleep. Wouldn't you agree?
Well, listen, anybody with IC tells you I'm stressed out of my mind, right? Mm-hmm. Sympathetic nervous system doesn't stop, keeps going away, right? Not getting enough sleep is a stressor, just like not eating, right? So if you've tried fasting, I love fasting. I think fasting is great, actually. But you are stimulating the sympathetic nervous system when you're fasting because your body's used to eating, right? And so then oftentimes I don't recommend fasting, although it's a great thing for patients with IC because it will make the pain worse. By the way, let me say one other thing, and because a lot of thoughts are coming up. How much longer we have? About 2 more hours or so?
I think 7 hours is good, right?
We're gonna need all the time we can. Here's the deal. I'll tell you a group of patients that do horrible with a certain diet. Okay, patients who suffer from interstitial cystitis on a raw food diet do horrible.
Interesting. Why
do horrible? Why is that? Because I mentioned already that the GI system is connected to the urinary system and the bladder. It's very difficult to digest properly a lot of raw foods.
Especially if your gut's compromised already.
Exactly. So that's more stress to the body. And from the school of thought of traditional Chinese medicine, right? Raw foods cause dampness, and interstitial cystitis is dampness of the lower jiao, like they would say, or the pelvic area, right?
That makes sense.
Yeah, absolutely. So no raw foods. Lightly, I understand the reasons why people want raw food. The enzymes, the nutrients are there. Yeah, they're only there and helpful if you can absorb it.
I totally agree. Yeah.
So what I would suggest is lightly steamed. Yes, keep it green. Don't brown it. The broccoli or the kale, but slightly steamed, and that's really helpful. So no raw food diet, and I'm probably going to get hate emails. I'll be honest with you, from them, because it's like a cult, right? It's like people become fanatical about their system or their diet, and raw food is they're high strong, and they hate when I say that, but it's the absolute truth. At least in this case with patients who have interstitial cystitis.
Yeah, and I found the same thing with people with Hashimoto's. A lot of times in the early phases of trying to recover their health, I'll recommend that they cook everything, even fruit, because they might have such a hard time with digesting of the plant fibers that are found in raw foods. So a lot of times, I'll have them on an introduction diet where they basically will have everything that's cooked. And then once the healthier your digestion is, the more raw food you can actually tolerate, in my experience.
That is awesome. Let me tell you something right now. I've seen numerous male patients with hypothyroidism who are raw foodists. That has changed once they ate foods that were lightly cooked or cooked.
Mm-hmm.
The raw food in some of these instances actually caused, like they eat raw broccoli and cruciferous vegetables, right? Which they have they have chemicals in there that have negative effects if it's not cooked on the thyroid, right?
Yeah.
They goitrogens.
Yeah, goitrogens are usually not going to be an issue for most people with Hashimoto's, but when you end up with so many of them on a raw food diet, and you can definitely suppress some of that iodine production and end up with an underactive thyroid. And we'll see a lot of people who are on raw food diets with very low body temperatures. And then things will resolve once they get on a more balanced diet that's a little bit more appropriate for them. And not to say that, raw food is never good for anybody, but just what I've seen in people with thyroid issues that, vegan diets and raw food diets are probably the least supportive diets, in addition to the standard American diet, where that's full of gluten and dairy. So
I'll say one last thing on diets. Diets is a very individualized situation. So while some people do great on paleo, others do horrible, right? Some people do great on ketogenic diets, actually. Others do horrible. So it's a highly individualized situation. But what I would say is that if you go from eating fast food and a lot of fried foods to raw food, yeah, you're gonna feel better.
Absolutely.
You're gonna feel better if you go on paleo. If you're gonna feel better almost if you go on anything other than what the standard American diet. Mm-hmm. But the diet that gets you well doesn't always keep you well. That's a tweetable.
I think that's a brilliant point. I love that.
Yeah, absolutely. So diets can get you well, but oftentimes they don't keep you well if you're not careful and not doing the right type of dietary approach for yourself.
I totally agree. You can get stuck in a diet and then you end up with nutrient depletion, such as, some of the more advanced elimination diets like the autoimmune paleo diet. It's a wonderful healing diet, but then at a certain point, you actually need to transition to introducing more foods into your life because you can become nutrient depleted from eating that way.
Absolutely.
And flora diversity actually decreases, and that can be, bad in the long term, especially with autoimmunity.
The microbiome, baby. I mean, come on. What's the hottest thing right now? The microbiome.
The gut.
Right? Right? So, I'm not suggesting to men who are listening to go to the bathroom and urinate and not wash their hands because to spread the microbiome. That's not what I'm suggesting. Just because some of my patients jokingly say, well, if the microbiome is so good, I want to spread the microbiome. No. You need to wash your hands.
That's good. I wish my dog would wash his paws because he likes to spread his microbiome everywhere.
Well, again, maybe you have a very healthy environment in your house as a result of your dog. I mean, come on, let's be grateful for your dog.
Well, thank you so much for coming on and sharing your brilliance with me. I really, really appreciate it. If people wanted to get more information about you, where can they go?
Well, I appreciate that, and really, Isabella, I can't believe, are we done? Is that what you're saying? I mean, I'm really here on a Friday night, ready to keep going. I mean, with your audience, are we just done right now?
I mean, we can talk for another 6 hours or so. What is it, like 9 p.m. in New York?
It's almost 6 p.m. All right. Maybe I should get home to my kids. All right. Thank you very much. It's been an absolute pleasure. I had a great time. I can't believe time flew so quickly.
I know.
Time does fly when you're having fun. drgeo.com. That's Geo with an E, not an I. So it's Dr. Geo, all one word, drgeo.com. That's probably the best way to reach me. I have, and there's I do have a prostate cancer book coming out. Should I mention it?
Yeah, absolutely.
So it's called Thrive, Don't Only Survive, Dr. Geo's Guide to Living Your Best Life Before and After Prostate Cancer. In my experience, so I treat maybe about 60% of my practice is prostate cancer. And in my experience, prostate cancer is an excellent opportunity for men to live an amazing life. So it's not, for the most part, it's not a gloom and doom scenario. It's really, wow, it's a wake-up call. It's, I need to get my life together. I need to reorganize and prioritize my values. And, what can I do to do that? So that's what the whole book is about.
Oh, I really love that. And thank you so much for the work that you're doing in the world.
My pleasure. Thank you for the work you're doing in the world.
Absolutely. All right. Well, thanks everybody for dialing in. And Dr. Geo, we'll see you soon.
Hey, take care. Pleasure. Bye-bye.